originally from Nebraska, Omaha, and I went to undergrad college at University of Kansas in Lawrence, Kansas. So I'm a big Husker football fan and a big Kansas Jayhawk basketball fan. I am married, been married for 14 years. My family actually just doubled in the last year. My wife and I had twins. They're 10 months old now, so we're having a lot of fun with that, and it's really changed my life quite a bit for the better. My hobbies are golfing. I like to travel, and now with my family, doing all the new stuff with them, I've got a whole bunch of new hobbies. I've been in Central Florida since 2000, so for the last 11 years. Basically, I came from my residency. I went away to Cincinnati for my fellowship, and I loved Orlando so much in the Central Florida area, the people and all the challenges and fun in Florida, that I decided to come back, and this is now we call this our home. Great question. You know, ever since I was younger, I've always been interested in played sports. I followed sports on TV, so I've always had that interest in athletics. I've had my share of injuries growing up as well, and always going to the doctor and seeing how I was treated and getting me back on the field has really piqued my interest at a young age to become an orthopedic surgeon, and then even to specialize in sports medicine. Well, you know, I think the best part about being a doctor is actually helping people. I know it sounds cliche, but when somebody comes to my office, they need me and they need that help, and I can provide that. That's half of it. The other half is just the interest in science and knowing that I can, you know, manipulate the body and the healing process, speed that up, make people better from that aspect, and just the science behind all of that and the mechanics of doing orthopedic surgery has always piqued my interest. Because I do sports medicine, I think that the most common thing I see is active or activity-related injuries or overuse syndrome. Certainly most of the patients I see are doing something in their lives that they would consider an active lifestyle, whether it's sports, whether it's just keeping in shape, cardio activities, or just work itself. So in general, what I see is injuries or you know, overuse type syndromes that occur with an active lifestyle. The best part about seeing patients and becoming a part of their life is that I actually, you know, meet a new friend, or I get to be part of their family as well. I certainly treat them like they're part of my family. I take a sincere interest in their careers and their family, really the other things that motivate them. I'm not the kind of doctor that says, oh, you hurt your knee, we need to fix it, let's do it, and that's it. It's actually, okay, what is your job? What do I have to do to get you back to that job? What other family considerations do you have? I have a lot of mothers that I operate on, younger children with school and their children, those kind of things that play into that. So to me, it's the ability with each patient. If I see 50 or 60 patients in a day, each patient I get to learn something new about them and meet a new person, basically. I chose to work at Orlando Orthopaedic Center because it's really, I feel, the best group in town. We cover all the specialties. There's really no orthopedic problem that we can't handle, and that's comforting to know that I have a partner out there. If I need to bounce something off of them, that I can do that. I also have great respect for all my partners. I feel that each and every one of them can provide great service to our patients, and I feel comfortable with each and every one of them, even treating my own family. I think that first and foremost, every patient from myself and my physician assistant Alicia should expect they will be treated like family, they will be treated with respect, and every patient will be treated like they are a professional athlete, because that's my approach to every patient. I try to get them back on the field or back to their jobs and careers in a respectable manner, in a timely manner. First and foremost, you know, I don't always jump to surgery either. That's a lot of, you know, that's a lot of the concern of a lot of patients. They see a surgeon like myself, and they think that they're automatically going to get surgery, and that's just not true. Most of my patients don't ever get surgery. I can get them better with medications, with physical therapy, with bracing, with injections, and those types of things, and that's always my goal for every patient.